Good evening and welcome to Responding to COVID-19 on TTT, Talk City 91.1 FM, and TTT Live Online on Facebook. I'm Wesley Gibbings. Now, some countries of the Caribbean, including Trinidad and Tobago, have scored very high on the global scale of responsiveness to the pandemic. With just 5 active cases and a rigorous testing regime, Grenada is one such nation. With us this evening in this segment of the program to discuss the country's progress with addressing the challenge is Prime Minister Dr. Keith Mitchell. Dr. Mitchell, welcome to the program.
Well, it's good to be here. And of course, it's good to be talking to your audience through the length and breadth of Trinidad and Tobago and the wider Caribbean.
Yeah, well, it's very good to have you here. Now, as I said at the start, the response by Grenada has been a pretty stringent and rigorous one, and you have had to make some very big decisions regarding the management of the issue. It's included a state of emergency, and it has included a host of interventions by the state very recently, including, and I know what this means to the people of Grenada and the rest of the Caribbean for sure, you've had to cancel Spice Mass, for example, which is big stuff in terms of not only people having a good time, but in terms of the economy.
Yes.
So what has generally been the response of citizens to these interventions?
Well, I think the fact is that we engaged the population from day one. When we understood what was happening with this virus, we first early in the game, we closed down, locked down the country, and we closed schools early. We were one of the first countries in the region to close down schools. And of course, educated and informed the population as to the seriousness of this issue. And we got good buy-in from all sectors. We involved the private sector, the trade union movement, the non-governmental community, and the church organizations, all denominations in the country, explaining to them the seriousness of this and what we needed to do. So generally speaking, despite the toughness of the decisions that we've made, we got strong buy-in from the population in a general sense. But the other thing was we were able to announce early in the game the stimulus package that we wanted to implement to aid the problems that were taking place in the country, because we lost St. George's University early with thousands of its students, and the economic hit that the country took. We took a big hit because when you have thousands of students and with the ancillary services in the country at all levels, it affected many persons in the country as a whole. And of course, the hotel sector lost most of its business. Lots of the workers were sent home. So we announced a package where we were providing 40% of the wages to the workers who became marginalized over the COVID-19. We involved the transport sector. We provided support directly to the bus association and over 1,500 buses in the country. We provided a monthly support and in some cases contracted some of the buses to provide with the protocol in place of 2 and 3 persons in a bus. We were able to provide direct transport for the emergency workers in the country to get to and from work. And of course, we had the state of emergency in making sure that people understand that we couldn't have the normal practices that we engage in on a daily basis. So generally speaking, I would say that we had strong buy-in in the country, and I think the citizens must be applauded. The health workers and all the workers in the country, the garbage collectors. Sometimes we forget these people, because if they're not out there cleaning the streets and ensuring the places is environmentally taken care of, we could have far more devastating impact with any virus that takes place in the country.
Absolutely. Now, you've spoken about the economic stimulus package or recovery package. Have you done an estimate of the damage or the level of contraction in the economy that has occurred so far?
Well, we are working on all aspects of it, but so far I can tell you the revenue, direct revenue of the country has dropped by 50%. And this month we start seeing it ticking over 50. It might reach, we have a few more days left in the end of the month. It looks that we might reach 55, 60% maximum. But we have taken a tremendous hit. I think, let me say this. I believe the only reason we are able to find the resources to be able to support the stimulus package is the way we managed the economy from 2013 when we returned into office, that we, the structural adjustment program that we implemented, and the savings, the fiscal responsibility that we implemented with the Public Sector Management Act that we implemented, and other activities that we ensure that we saved in a very serious way, that we had the fiscal space. We had, for example, a contingency fund that we implemented, and we stuck to it so that even our management of the economy helped us to drop our debt to GDP ratio from 110% to 60% in just 5 years. So I think that room that we had, we were able to use a measure of that saving to provide some help. Had we not have this in place, I don't think we would have been able to do this. And therefore, the pressure on the population would be far more devastating than it is at this particular time.
As has been the experience throughout the length and breadth of the Caribbean, certainly here in Trinidad and Tobago, some of the measures that had to be taken were by no means painless or pain-free. What do you consider to be among the more difficult decisions you've had to make with respect not only to the economy, but in terms of how we operate as social beings and as Caribbean people?
Well, let's face it. For example, I told you one of the tough ones is the fact that we've been advised, and quite rightly so, that the social interaction is going to be a problem. Many of us have our parents. My mom, for example, is 97 years and going. We're told I have to go, when I go to see her, I have to sit outside in the veranda and speak to her because I wouldn't want to, because I'm moving around, you never can tell. Yeah. I wouldn't want to be the one leading to a physical demise. And I think people are paining over this. Grenada is a very interactive society. People have a very strong relationship with each other, and it made it very difficult. Even for me as a political person, you were not able, you had to speak to people on the phone, speak to people on Zoom. But just the feeling that you normally get from interacting and listening to people, not just hearing about their problems, but feeling it from a physical standpoint. I think that was a very painful decision. And a situation, again, where many people who were working and been able to take care of their families never had to ask anybody for $1. Some were marginalized to the point, for the first time, they had to literally beg. And you and I know Caribbean people are very proud people. Yeah. Even when they don't have something, most of them, they don't want, they feel bad to have to ask you and to tell you how they actually feel. If you were able to go and speak about what you've given them, they will turn against you because they don't want people to know that they had to come to beg you. So I think that sort of results that we recognize in the country was very painful for me as leader of the country and for the political directorate and for generally for people in the country as a whole. Another thing I think, we in the Caribbean, people love the religious association and activities. To stay away from church, not having to be part. I know my mom, it is difficult for her because she's a strong Catholic and she doesn't miss her mass. And I know many people were calling, and when we opened the church, but we had to counsel them. And I must say, the leadership of the church community, they were very good. They provided leadership. They didn't leave it up to the government because, the general feeling that the independence of church and state, that concept. So some people might have felt, if we did not buy in from the religious community, that the politicians are interfering with the religious association and activities. We didn't have much of that problem in the country.
Now, I know that one of the particularly challenging areas has to do with the return of nationals who have been outside and are now
Yes.
seeking to re-enter the country. I know that Grenada has accepted, is it about 3 or 4 cruise
Yes.
passengers that have returned. How is the general management of that issue? In Trinidad and Tobago, it's highly contentious because, like elsewhere in the Caribbean and elsewhere in the world, there have had to be barriers erected even against the return of citizens. How is that being managed in the Grenada
Well,
context?
well, well. The fact is, in fact, I had to appeal to the population in a national address. I had to appeal to both sides. I indicated to them, one, you cannot prevent a national from being back in his country. You can't, I mean, you have to understand that the Grenadians have a right to be in their country. That was speaking to the local people. But at the same time, I appeal to those wanting to come back, realize that we're in a different ball game, that we have a serious problem facing us, and people are very concerned about persons. It doesn't matter whether they're citizens or not, coming into the country and creating health problem for them personally and collectively. So I ask for understanding. In the process, therefore, we put in place systems for the cruise ship workers, for example. And so far, you mentioned just 3. We have had over 140 odd persons already and more coming in. And so far, out of the 100 and odd, only 1 person came in positive at a PCR test. And they were quarantined, and we didn't, there was a little problem initially, but that was solved overnight. And I think we've seen the buying of the population, understanding that what we are trying to do. But at the same time, we have a lot of citizens who went out on vacation in New York and London and other places, and they are really putting enormous pressure and indicating that they're spending money and other things are literally gone, and they want to come home. What we have done, we have indicated to many of our nationals abroad that if they can organize a charter service and go through all the protocols like testing before they come in and prepare themselves for some quarantine at their individual homes, we are prepared to examine this on a case-by-case basis. We have indicated to the hotel sector, if a hotel can able to create a chart to form a charter service that brings in people specifically to his hotel property, and we are prepared to examine this with the protocols in place. But to open the border just like this for commercial flights with people going to every single hotel possible, unless we have that understanding and organization for all hotels to operate under the protocol and have the necessary support, financial and otherwise, to implement, we can't open it up just like this. So there had to be a lot of work done by the cabinet appointed COVID subcommittee, who has been working with the different hotels, the different groups around the country to put in place a system. And at this point in time, the projection that they have given me, the recommendation they've given the cabinet, is that by June 30th, we think we should be in a position to have all the protocols in place.
Great. And we only have 30 seconds left, so unfortunately, but finally, do you have a timetable in mind in terms of the reopening of the country and resuming commercial activity?
Well, we have, in fact, reopened many activities already. The construction sector is back on, and we had a number. We opened and indicated that you must apply to the Ministry of Works for a permit to start back your project. Those that were on, and those that are restarting, and those that are planning to start. And in the space of just 4 days, we had over 250 applicants ready to go, and some of them reasonably sized project. So the construction sector is basically back on. We have the buses now are now back on from Wednesdays with the protocol of 10 and less persons in a bus. The retail stores, generally speaking, are back on with the protocols that we have established. So then the schools are planning on a phase basis. For example, the students are going to CXC, and people like that are coming back on within a few weeks. So many of the activities are now getting back on stream, and we are doing all that we have to do. But one thing I say to people, and before we close, and I want to repeat it here, Yes, we want to back the economy. Yes, we want to get business back on. But, you know, health first. This debate going around the world about we need economy and health and economy. I say health first, because if you're not well, material and money means nothing to you. So that's our position, and that's where we see things. So I'm looking forward to the continued support of the population in general.
Okay, thank you very much, Prime Minister Dr. Keith Mitchell of Grenada. Thank you very much for spending this time with us.
Well, thank you for your information. And let me just say a special hi to all. You know, half of the Grenadian population in Trinidad, yes, particularly your Negro populations, have Grenadian connections. So we are sisters and brothers. So I want to say a special hello to all of them.
Thank you very much, Prime Minister of Grenada, Dr. Keith Mitchell. Stand by, stay with us, listeners and viewers. Up next, Chris Corbin of the United Nations Environment Program. We're going to go to a break now. Welcome back to Responding to COVID-19 on TTT Talk City 91.1 FM and TTT Live online on Facebook. I am Wesley Gibbings. In this segment of the program, we'll have a look at the state of the region's marine environment in the face of the COVID-19 challenge, and also within the context of serious challenges to its continued health and well-being. I welcome Christopher Corbin, Program Officer at the Cartagena Convention Secretariat of the UN Environment Program in Jamaica, to discuss the state of the Caribbean Sea. Welcome to the program, Chris.
Thank you very much, Wesley, and welcome to all our listeners and viewers.
Great. Now, what is the diagnosis with respect to the state of health of the Caribbean Sea?
It's not as bad as COVID-19, but it's not good. And I think what we are seeing and what we have seen over the years is a continued pollution, continued degradation in our coastal and marine ecosystems, declines in our fisheries, in our fishery industries. And yet at the same time, we are looking to the ocean and to the Caribbean Sea as a way of expanding and enhancing our economic development. So we are talking about blue economy, we are talking about ocean-based economies, but I still think we have to focus on some of the key negative impacts that we are responsible for that are impacting the marine environment.
Now, and among those issues would have to do with the amount of ocean litter. And I know that tomorrow you are going to be part of a webinar hosted by UNEP that's looking at the particular problem of ocean litter in the Caribbean Sea. How much of a problem is it?
It's big. When you think about it, Wesley, 75 to 80% of our waste generated on land ends up in the marine environment. And over the last few years, the issue of plastics has really gained global recognition. The issue of microplastics in fish, the issue of plastic islands. So I think that has really forced pretty much the world to take note of the poor practices as it relates to solid waste management, but also the potential negative impacts and the ongoing negative impacts that plastics pollution has. I think what it's also allowed us to do, and maybe that's the direction we need to go, is we have very much a throwaway mentality. How can we now continue to develop by now looking at green opportunities, plastic recycling, and even trying to look at alternatives for plastic, which I really think many of the governments in the Caribbean are already looking at.
Now, is there anything in this COVID-19, in the midst of this COVID-19 challenge, to direct our attention in a positive way with respect to these issues?
Well, UNEP has been very much promoting that this is really an opportunity for us to step back and reflect. And we have been promoting that as we look to build back, as we look to stimulate economic recovery from COVID-19, can we now look at solutions that better integrate with nature? For example, traditionally, we have known of the use of artificial wetlands to deal with our problem of sewage and wastewater, to remove nutrients, to remove sediments. Can we look at how we can work more harmoniously with nature than against it? And I think it's a really strategic opportunity for us as we start to think of new economic paradigms and new approaches, that we really take a look at what type of development do we want as a region, and how can we now maximize on these opportunities. Europe, for example, is very keen on promoting the issue of waste as a resource. And they're now looking to see how can they support regions like ours to stimulate development, to stimulate livelihoods, but at the same point in time, not create more problems. There is a concern that we have, and we know how important it is for our frontline workers dealing with COVID-19 to protect themselves, but we are already seeing poor management of masks and gloves just being littered into rivers and gullies and the sea. Now we need to remember that good waste management is still needed. We need to take care of those frontline workers and not expose them to greater risk by disposing now of medical waste and hazardous waste in an inappropriate manner.
Now, so a lot of the bigger, more substantial interventions that are required to address the issues you have raised there, which have to do with solid and liquid waste management on the land, which finds itself in the marine environment. These are not cost neutral sort of issues. And, Caribbean economies are not going to find themselves in the best shape from an economic standpoint. Are there ways that are being examined to address the concern of the cost of these things?
Definitely. And I think one of the failings that we've had is a very traditional cost-benefit approach to how we deal with environmental solutions. If you think of the value of our tourism industry, the millions of visitors which visit, if you think of the value of our coral reefs in terms of the protection from climate change and sea level rise and flooding, if you think of how much it's costing us in terms of damage to infrastructure by poor solid waste management practices, these are the kinds of business studies and business models that we need to better formulate, so that when we look at these solutions to what is perceived as a no-win or no net recovery of investment, that in fact there is a significant recovery on investment. The other element that UNEP is trying to work more closely with governments on is the whole concept of blue and green strategies, or green and blue economic agendas, which also recognize, for example, the value of wastewater as a source of energy, as a source of nutrients, as a source of potable water. But we haven't formulated those into integrated proposals that are then bankable, because that then allows us to approach private sector, to approach the development banks, that this investment in a nature-based solution, or even sometimes in an infrastructural solution, is a win-win situation.
But do you think that the current COVID challenges and the fact that there is now a lot more attention to the public health issues, the public health impacts of the state of our natural environment, the state of the human condition, that is going to steer us more and more in the direction of looking at green and blue approaches to development?
I certainly hope so. I really see this COVID-19 situation and pandemic has really brought forward how integrated we need to be in our development planning, how integrated the issue of environmental health, on public health, on safety, on economy. I don't think even as small islands, we realize how vulnerable we really are. We say it in the international agenda. We talk about how vulnerable our region is and how vulnerable as small islands we are. But COVID-19 has forced us to face that front on. And I think now we have a really ideal opportunity with the support of development partners, as you say, to shift that focus, to really look at solutions that bring benefits to us, build our resilience so that we are more able to respond to these kinds of issues, but at the same time ensure that we have environmental sustainability.
Okay, now coming back very quickly as we wrap to the Global Partnership on Marine Litter and the discussions that are going to take place tomorrow online. Has there been an examination of ocean transport activity during this COVID era, which has slowed? So you don't have the cruise ship activity at that level, but you do have cargo ships and you have other marine vessels that are making. Is there any evidence that's linking the state of health of the ocean with and this period of slowdown in terms of ocean transport?
I wouldn't say a comprehensive analysis has been done. There's been some look at the generation of waste at a national level and local level. More waste, of course, coming from households, less from commercial properties. There has been a look in terms of the demands of the shipping industry. There's been, yes, some cargo movement because of some of the restrictions that are put in place, things like abandoned and lost and discarded fishing gear, you're not seeing as much of. But what we want to do in that Global Partnership on Marine Litter and that webinar tomorrow is showcase some of the positive actions that have been ongoing. We have some excellent research going on in Grenada and St. George's University, looking at the presence of microplastics. We have partnerships with various private sector agencies working along with communities. And then we have the importance of engaging communities, local communities, through citizen science. How do you monitor? So that point that you raised, is the situation getting better or worse? What is the situation with marine pollution and litter? What are the types of litter? It's only by knowing that we can make more informed and science-based decisions.
Okay, thank you very much, and thank you for appearing on today's program. I want to thank you, listening and viewing audience, for staying with us on responding to COVID-19 on TTT Talk City 91.1 FM and TTT Live online on Facebook. I am Wesley Gibbings. Today's guests were the Prime Minister of Grenada, Dr. Keith Mitchell, and Christopher Corbin of UNEP Jamaica. Please continue to stay safe and alert. Wear a mask when venturing out, practice hand hygiene, save lives. Goodbye and see you sometime again in the future.